doesn't necessarily have to be a specific sport. It's ultimately just making sure that I understand the requirements and demands of where they are and where they want to go.
It's a bird.
It's a plane.
It's the Glute Guys.
Howdy, everybody. Welcome to the Glute Guys Network. Today, we have another special guest, Dr. Ryan Norland, PT, DPT, Remote ACL Coach. Ryan, thank you for coming on the podcast.
Thanks for having me.
Ryan, we're really excited to have you on. You've got something really unique going on in our PT realm. We're excited to hear your experience and your adventures with it and more about it.
Yeah, dude. Share.
Mm-hmm. Just to start off with a softball unrelated to, ACL coaching, stuff like that. How did your fitness journey start, and how did it bring you to where you are today?
So, I grew up playing sports all my life, and by the time, I would say around high school, I was trying to figure out a career choice. Had a couple injuries, nothing major, and my dad kind of knew a physical therapist. I shadowed them, and then, basically went to Ithaca College all 6 years, but I ended up playing soccer there. I played Division III soccer, and then after soccer, coached for a little bit and got into CrossFit and Olympic weightlifting. And then, I'm someone that just continues to learn, grow, trying to always improve myself, my skill sets. Ended up actually getting my MBA a couple years ago. And I also got board certified in orthopedics and did a fellowship in manual therapy. So constantly learning. But I think that's the more you're out there, more experience you gain, the more you realize you don't know as much as you think.
Yeah, I've had a few students. I just had one for the last week. I was covering for someone else. And it makes you think about what you do know a lot. And then it also is man, there's so much stuff that I sort of knew right coming out of school that I just don't really have to think about anymore. Like peds, for example. I don't really do anything in peds anymore. And it just makes you sort of want to do a little bit more, research or maybe some continuing ed type stuff, especially with, the end of our 2-year period. We got to get everything recertified.
Yep.
Credit time.
Mm-hmm.
I always feel like you get some of those patients that you get humbled with, where you either do something, you learn something new, or and it could be anyone, to be honest.
Mm-hmm.
Yeah, it's always the ones that you least expect to, and that's when the real learning happens. But I feel like in our careers, especially, it happens in every career, but especially our career, constant lifelong learners and always looking for ways to add tools to the toolbox to make us better too. So I agree.
Mm-hmm.
Yeah.
So you got into physical therapy. What made you decide to go into remote coaching, ACL type stuff?
Yeah, that's a great question. So, working with ACLers in clinic, kind of realizing that, first off, it's a huge problem. Second off, there's insurance issues, and the care that you provide in person sometimes really isn't enough. A lot of people get cut off insurance-wise. There's a million ways I feel like I can take this conversation. Not every PT is created equal to some degree, right? You have a lot of people that are stagnant, that just kind of don't want to learn or aren't passionate about treating the patients that they want to be passionate about. And so remote coaching kind of scratches that itch of providing way more support to someone going through a process that is devastating. It's really rewarding to see all the hard work that they put in, but also working together to accomplish a goal. I always have enjoyed that in person, but for remote, it's almost even better because you have even more touch points with them.
Yeah, so like you said, there's a lot of stuff to go into just from that. Insurance in particular is always a pain in the butt. I know it's the same thing for me too.
No, what are you talking about? Insurance is great. They definitely don't cut off patients too soon before they hit their functional goals. And, as long as the patient can get up out of the chair, then they can get back to playing soccer, right?
Yeah, of course.
No, insurance is the biggest bane of our careers for sure. They they like to try to control the treatment session, unfortunately. And you see a lot of these athletes who, in an insurance microscope, they look fantastic and ready to get back out to everything, when realistically, it's like we haven't even worked on the functional parts of their sport, whether it's the cutting, it's the drills, it's the foot plant while kicking a ball, like it's, and just the added strengthening exercises and things that they need too. So the nice rewarding part about it for you, Ryan, is that you get to continue working with them, and they're very passionate about it. It's something you're very passionate about. So it kind of drives that relationship with the two of you guys, your client and you. So I think that's awesome.
Yeah. And, part of it is that a lot of these people either have a loss of identity, they have fear of re-injury, they're worried about getting back to their sport, they don't have confidence, they might be confused about where they are. And there's a lot of different nuances too, right? How many times someone hit 9 months and they say they're cleared, but they're not actually ready. Their doctor says they're cleared, but they're not even close to being able to play their sport. And if they do play their sport, they're at a very high risk of re-injury.
Oh, yeah.
Yeah, so I guess, again, like the mental component is very broad, but like you touched on a few ones, like fear, loss of identity, confusion. How would you go about it sort of as a stepping stone to, I guess, sort of figure out what it is mentally to work on, and then based on that, work on it?
Yeah, no. I mean, I think first off, you have to kind of zoom out. And at the end of the day, me working with clients, it's about doing a needs analysis and understanding first off, where are they? Where are they in the picture right now? And where do they want to go? Okay. You want to get to high level soccer demanding, then we need to zoom out and say, okay, well, what does that sport demand? And how are we going to develop those qualities of strength, reactive strength, explosive strength? And it's really about just understanding where they are. So running them through tests and providing communication, but also clarity about where they are. And I think once you can figure out where they are and provide that clarity, it gives them a self of confidence because they kind of understand it a little bit more. It's not only just like giving them the exercises, it's also educating them on like, this is where you are and this is where we need to be in order for us to move on to that next stage.
Yeah, so that's a lot like my population too, like working with geriatrics, that if you don't really break it down and think about each thing that you want to work to, it's sort of hard to progress and modify based off of that.
Yeah. And like, I'm all about numbers at the end of the day. Obviously, there is a subjective component about ACL rehab, but I think too many people are brought through a subjective lens, and if it's your first injury, Aaron, they don't really know what to expect.
Yeah.
So like they may say, there's plenty of people that I talk to that they say they feel great, but then you set them through a bunch of tests and you're like, oh, we need to work on this because like you're not using your knee. Like, and that's a typical compensation. There's lots of compensations with this injury, and a lot of them don't use their knee. They figure out ways not to use their knee. And so kind of keeping that, education aspect and really understanding where they are and teaching them all that is like really, really part of the journey back to whatever sport they want to get back to.
Yeah, I think that's a big thing that a lot of people miss during treatment sessions, whether it's like the online coaching or even in the clinic, that education piece, like really just breaking it down for the patient to their level, for their understanding, so they know what we're going to do. And that's probably without a doubt the most important part of the treatment. And it's sad that a lot of, not to knock anybody, but there's some clinicians out there who miss that piece, and the patient doesn't really fully understand their injury and what they're looking for and how we're going to get to those goals. So breaking down that psychological barrier and that emotional barrier for it is incredibly important.
And there's a lot of people that I feel like miss milestones, and then they wonder why they have problems. And it's unfortunately the guidance that they are put through, the guidance that they have isn't necessarily the greatest guidance. So then they miss steps, and then they start developing swelling or pain or issues, and you have to kind of go back to those early stages to see if we can clean things up.
Yeah.
So, based on all that, do you have any, I guess, stories that are your favorite just since you started Remote?
Yeah.
Yeah.
I mean, I have a ton of great clients that I love working with. Everyone has a different story. And so meeting them where they are at and really getting them fully back to sport, I've had someone that was in Portland, getting them back to playing full on-court basketball was like so rewarding. And this is someone that didn't miss a workout. And you when you look at this being such a problem, like, you know, high deductible plans, insurance, kind of getting back to the insurance thing, like you go for a visit, you're cut off in an hour, right? With remote coaching, I'm planning everything out and giving you as much exercises and as much feedback as possible to get you pushed through to the next step, making sure that we're pushing the needle. Um, and so to me, like getting someone from like not being able to run to being able to finally dunk is like such a cool accomplishment. And it's not necessarily me doing the work, but I'm fully committed to getting them there and helping them, giving them the guidance, showing them where they need to change, giving them form corrections and feedback. Having Google Meet sessions where we record things, break things down, and make sure that they kind of have the clarity about the process. Because at the end of the day, if they don't have clarity, there's no communication. They're not going to have confidence.
Yeah. And
No, I agree.
like going back to the insurance for geriatrics again, of course, I got to bring it up.
Yeah, you're good.
There's like everyone's heard of, well, physical therapists, like the 8-minute rule. And for Medicare, you want to do 53 minutes, and that is how much you're supposed to do. They usually don't want less or more, and there's a potential that they're not even going to pay if you try to go out of those ranges. And there's so many people that it just doesn't apply to. Like it could be to the point where someone's so low level, like maybe they have a cardio problem or a pulmonary problem, and you do a tough 35 minute workout with them, and there's nothing left. Like there's nothing left you could do. You can't stretch it to the 53 minutes just because you want extra units. And then some people, you'll be doing stuff and you're like, man, this person, they're in really good shape. I might have to, get this a little bit longer than the 53 minutes too. You sort of never know what to expect. But yeah, that's a pain in the butt about that insurance.
Yeah, you think about it too. Like when I worked in person with ACLers, like they'd be with me for like 2 hours, and like I'm not necessarily someone that, from my perspective, is billing tons of units on them. I'm going to bill what I would normally do during a session, and then they're going to benefit from this, and I want them to get the most benefit out of this.
Yeah.
So that's kind of where it is. Whereas other people might be like, all right, Aaron or Tom, it's been 45 minutes. Let's, call it a day. You did enough, get out the door. The next person's coming in.
Yeah.
Yeah. No, it's there that it's gotten structured like that in a lot of like the clinical settings, that it's very much based on like the minutes and just I apologize for the squeaking, he's a baby. But it's very much based on just like those appointment slots, and like once it hits that time frame, it's like they're out, and there's still so much more work that needs to be done, especially with someone who's like an ACL type tear. I'm sure you can agree that every ACL surgery rehab is different. Everybody looks different. I'm sure there's not one that looks identical, and there's going to be different things that they all need too. I wanted to talk a little bit about your Google Meet. So that's something where you're also going over like their exercises, like right on camera with them too.
So I actually go over, so they video their exercises. I make them kind of do it a certain way. The more videos they provide me, the more I can break things down. Let's, for example, take like a split squat, right? A split squat, an ACL, anytime you see that front leg, if that front leg is their right leg and they're doing a split squat, a lot of times they're not actually using their quad, because at the end of the day, ACL rehab is strengthening the crap out of the quad. And so they compensate a lot. So having them have like that one side and having the other side, like I have an app that can compare left versus right, and then you can look at where they're shifting their weight and you can draw on it. You see my face. So that's how I give feedback, especially early on when they're like kind of new and trying to learn the new block. As far as Google Meets, I meet with them about every 5 weeks. unless something is like concerning that we need to like tackle. And that's kind of one of the advantages to remote coaching, because if something comes up, they don't have to wait to see me next week. Oh, I'm on vacation. Like, we can handle it as soon as I can get to it.
Mhm.
You know, I've had people that have had cyclops lesions, right? They're not getting their knee straight. I had someone that had a cyclops, well, was limping for a year, had surgery, was still limping, and 4 months into it, you know, found me. We ended up working together, realizing the cyclops lesion, got an MRI, got it all squared away, and we're going. We're not waiting. We're not wasting time. We're figuring this out, and then surgery, and we're walking them through all those different aspects of like trying to get their knee straight. And so that's kind of one of the benefits, is that it's not only flexibility, but like I'm kind of in their pocket at all times.
Yeah, it's always nice to have someone that you can just contact whenever you need them. Like you said, sometimes when you're just going to the same facility every time, it gets a little bit tougher. Like I think my job is sort of in between you guys, where they still talk to me because I'm the one they have to contact if they want to schedule, if they want to do everything. So I hear from them a little bit, but it's actually sort of funny because a lot of my patients will even say, like, I don't want to call you on like not in work hours. We almost just want to be like nice and I guess reasonable. And then you have some people that I'll get a phone call at Saturday at 2 a.m. and you're just like, I can't
Oh,
answer
yeah.
the phone right now too.
Yeah.
But it's nice to have the opportunity to help people a little bit, especially like you said, when they really need it, when there's really an issue that needs to be addressed right away.
I mean, I'll kind of side quest here, but like I remember getting a text from a parent about this cyclops lesion, and like basically getting the MRI results, and it was like shocking to them, like, you know, that there was a meniscus tear and there was all this stuff that we need to like figure out, you know. So being able to like call them like a half hour later and be like, hey, let's talk this out, and like let's get you off the ledge. Let's make sure that you kind of understand what are our options. Like, what do you need to know when you go to the surgeon? Like, what's most important? And providing that education is really, really helpful. And I think a lot of people just want to know, like, what are the expectations? What are the options? And like, what's their scenario? Like, what do they need to do?
And I think that helps a lot with the psychological and the emotional barrier side of it too, because I mean, in a regular clinic setting, I'm an outpatient orthopedics. My patient goes and gets an MRI. It might not be another week or so until they go and see the doctor and they talk about it, or if they get it in time and they let me take a look at it, and we get a couple of days has now passed by. Now I don't know what's going on in their head, especially for someone who's an athlete. They think that this is the end of their sports career. They don't think I'm not going to be able to get back to playing basketball or soccer or volleyball. So having that instant access, like, hey, let me look this over. Give me a half hour, an hour, and I'll give you a call. Let's talk about it. That I'm sure eases their minds immediately, and then you get to educate them on it and help just reset the whole vision for them too.
Yeah, and I mean, like, I remember this case. Like, this guy had a meniscus repair with a quad graft, and you know, unfortunately, people, if you know anything about ACL rehab, like having a meniscus repair, non-weight bearing, having a quad graft, another issue because your quads are now injured, and so he's not weight bearing for 6 weeks. There's issues with that, and then to find out that you have a cyclops lesion with a meniscus repair. I mean, especially when you just had that repaired, like that's an issue. I would be really upset. I'd be like, I didn't do anything. Like, why did this happen? And so trying to, have them kind of take a step back, understand like what are your options, and like walk you through that, make sure that you don't go through this again. I mean, at the end of the day, once you get through that really tough time, like it can be empowering.
Yeah. And you never want one of the scariest things, someone to go on Google and start Googling all this stuff.
You beat me to it. I was going to say, and you cut out Dr. Google immediately. Because the best is when you have a patient who comes in the clinic like 2 days after their MRI, like, so I Googled it, and you're like, oh no. Now you think we have to amputate the leg.
Well, soon it'll be ChatGPT, Dr. ChatGPT.
Yeah, I think it's transitioning to that too, because I've had a couple of patients like, I asked the AI this, and this, and I was like, yeah, let's still not do that. All it's doing is compiling Google faster.
Yeah, I guess this is completely in another direction, but what do you think about like AI with physical therapy, rehab, ACL repair in general?
I mean, I think it's good to some degree. I think there's a lot more nuance than people really understand. Um, and everyone wants the answer to their question. Their question's always an uncertainty question at the end of the day. And so, like Tom said earlier, like every case is different. So, you can give them the answer, but it may not necessarily be related to what they're going through. And at the end of the day, I think AI can be great, but ultimately you need to be doing the exercises and making sure that you're doing the right exercises, making sure you're not compensating, making sure that you are tracking your numbers, tracking the data, making sure that you're getting stronger. Honestly, ever since I started this remote coaching, it's been so rewarding because it's a structure that should be in physical therapy. So, like, for example, when someone starts working with me for the first week, them through tests. I have different tests depending on how early or late stage they are, and I get that data to really understand where they are in the process. And so, in physical therapy, we do an evaluation. Great. But lots of times, once you do the evaluation, sessions go by, and people are never re-evaluating. And if they are re-evaluating, they're doing a crap job to really re-evaluate. You're using manual muscle testing, which we know you can't prove someone is stronger by doing a manual muscle test. And so in remote coaching, every 6 weeks, for the most part, I'm retesting them and then giving them a new block. And so depending on where they are in the process, we may add, we may change, but it's structure that really in a physical therapy world, there's just not enough time. You're not getting paid to structure someone's rehab plan. A lot of times you're thinking on the fly. And so that's why I really love working with clients remotely, because you're paying me for the structure, you're paying me for the clarity, you're paying me for those aspects, which are really way more important than just doing exercises aimlessly.
Yeah. I mean, with your model, you really just you set physical therapy free, like you said, how it should be. You cut the ties with the insurance company, we throw it right out the window and say, we're not going to worry about what the insurance wants or says. We're going to worry about what your body needs in order to get better. And you hit the nail on the head before with it's making sure that they're doing the exercises, but it's also the right exercises. Even going back to the AI system, I just remembered I keep seeing ChatGPT commercials, and one commercial was like, how can you help me do a pull-up? And you're like, okay, here's the exercise routine, how to do a pull-up. I was like, oh no, we're going this direction now. I'm like, this is going to try to take our jobs, but it can't, because it's never going to be able to determine the deficits that we can in an objective way versus, just the plug and chug answers that we end up seeing online anyway.
Can I add something too? Is that people don't want computers telling them what to do.
No.
People want relationships. People want communication. They want to know me. I want to know them.
Mm-hmm.
That's how you work together. People want to see you, Aaron, see you, Tom. People don't want to be like, oh, let me go check into my app and talk to this chat bot and figure out what I need to do. I would say most people actually want to be heard, and they're not going to be feeling heard for using ChatGPT.
Mm-hmm.
And that's really it right there. They claim that the AI system's it can kind of think and do for itself, when it's still really not doing that. It's still just a computer running a program. It doesn't think really for itself. It's just doing what it's programmed to do, and it'll never have the human connection and that human touch to it that is needed in our kind of field too.
Yeah, and I mean, it is very good at diagnosing for sure, I would say, is what I've heard. But as far as treatment or exercise routine, I mean, you can't necessarily replace those relationships that you're building.
Yeah, I know that was a big thing for me on why I actually went into geriatrics. When I was in school, we would have like an outpatient internship, and I would really get to spend 15, 20 minutes with a person. And I found I just couldn't really get to know them or really build anything when there's that little time. And at least I'll get like an hour, and I find that it just gave me more time to really process everything. And it gave even my patients more time to get to know me better. And then they'll just sort of say anything. They're not nervous about saying stuff anymore. Like I've had tons of times where a patient would just be like, "Oh, I don't ever tell my family this, but I'll tell you." And without that information, we really wouldn't have gotten anywhere. We would have been sort of stuck in the same sort of loop, not really making any progress. All right.
Yeah, no, I agree with that too, Aaron. It's awesome in the relationships that we get to build through these processes too. And I think that what you're doing, Ryan, is giving it even more of that human touch and being able to build those relationships even further than we can in the clinic.
Yeah.
So-
No, go ahead. You're gonna say.
Oh, I was gonna change subject. So if you want to say on
No.
subject,
You're good. You're good. Change the subject.
so if someone is a new grad or they've been doing PT for a while and they want to get into remote stuff, how would you recommend you get started?
That's a good question. I think ultimately you need to figure out what you want to get into, and what niche you want to do, because you could be very broad and you're not gonna, when you are marketing yourself, you're not gonna basically figure out, like, you're gonna be casting such a wide net that you're not gonna be able to be very specific and people aren't gonna hear you. So one thing is figuring out what the niche is. I went through an incubator through Honey Badger project, which was really helpful. It kind of taught me, kind of the foundational things that you need to be doing as a remote coach. But there are lots of other coaches out there that do a lot of the same things. So I think if you want to do remote coaching or figure out another way to, whether it's a side hustle, whether it's your own business, it's really trying to find that information and find someone that can help you kind of provide that information.
So in some ways, it's sort of like, I guess, like an internship in college or in PT school, that you go, you try it out, you talk to somebody, you get knowledge from it. And same thing when you first start too. Usually it's good to have like a mentor or someone that can help build your knowledge base and sort of guide you in the right direction.
Yeah, no, definitely. And then on top of it, like, social media is a whole nother aspect to it, right? And I'll say this, like, my first couple of videos, cringeworthy, but the only way you get better, honestly, is by doing. And I think that's with anything, right? Like, our profession, how do we get better as physical therapists? By doing. How do you get better coaching? By doing. Like, it's not really the textbooks that get you better. It's the
Now-
action you take.
Yeah, and
Exactly. That just gives you the foundation.
Mhm. Like you said, the terrible videos when we first started, we could definitely relate to.
Hey, take a scroll on our YouTube, Ryan. Go all the way to the bottom, and you'll see some of the embarrassing stuff that we've done in the beginning over a year and a half ago, for sure.
Oh yeah, and I put some shorts on YouTube. YouTube, like, we sort of try things out on there, and there's definitely some misses, and then there's some
good.
stuff that's pretty good too.
Yeah, and the only way to get better too is to do it.
Yeah.
We've
look
definitely
at-
come a long way.
Mm-hmm. And it's like a new skill. It's like something that you just have to develop and keep doing and doing and doing. Like, even with these podcasts, I think we've gotten to the point where we've done a bunch of them, but there's still little things that every time we watch, okay, we could do that better, we could do this better, and we keep growing from there. And honestly, the nice thing about the podcast is we talk to so many people that we're like, I probably wouldn't have talked to that person if we weren't doing this. And it gives you like a whole new perspective that you never would have thought of before.
Yeah, no, I mean, it's all about perspective at the end of the day.
Mhm.
Yeah. It opens up a whole community too, where it's like we talk to all different types of people, all different careers and different coaches and things that they're doing, and it's been pretty rewarding too. And I'm sure that you've had similar experiences, especially with the honey badger stuff too. Like that's all connection based stuff. That's what it's all about.
Yeah.
Yeah, we've had a few people on the podcast that are affiliated with Honey Badger too. We had Jared
Jared.
Unbreakable, and yeah,
Yeah.
and then the MMA doc we had as well. And
Cool.
you can tell they're very caring people when it comes to that stuff, and they do a good job of, I guess, guiding you in the right direction. And if they don't know, they'll let you know who to talk to and who is good to help develop all that stuff. So yeah, they're a good group of people to know. As far as building your brand, or I guess getting a more of a caseload, was that something that it sort of just veered off of when you were working with people, like in person, or is that something that you had to actively like work for a while in order to build it?
It takes time to definitely build. So, it starts slow and then you get one, then you get two, um, and I'm constantly working at it, trying to improve, trying to figure out ways to, help people, and figure out ways to market myself. So it does take some time, but it does grow. And it's one of those things where it's kind of like, I think how you guys probably feel with the podcast is like getting more reps under your belt. It just eventually compounds and you just got to keep kind of going. And I tend to think like everyone doesn't want to lose, right? But the only way we like really grow is by failing. And at the end of the day, like the only way you really lose is if you quit.
Mhm.
So like if I don't quit and I keep going, it's just going to compound. Yes, I'm going to fail, but I'm just going to grow from that and it's going to be another opportunity that I learned from.
Yeah, I think it's just it's very common nowadays to like not be accepting of failure when failure is just part of life. If we're not failing,
Yeah.
we're probably not really pushing ourselves to do any better.
Yeah.
Even working with
And
patients too.
I mean, thinking about like my first video, like just to gain the confidence to do that. And now it's like not that big a deal versus like, the first video was like scary, right? Like
Oh yeah.
I'm putting myself out there. I'm super vulnerable right now. And, that's what it is. It's like going over that hill and now you're on the other side.
Yeah.
Yeah, and it's like
Yep.
each failure is an opportunity, like you said, to grow and to make yourself better. And each, like you said, rep is a way to just continue to improve. And we can definitely relate with that first video. Aaron, how many takes did we do for our intro?
Yeah.
We
That-
kept like
a
stuttering
lot.
and like, yeah, we must have like. So we actually used to do these in person, not the interview parts. We've always done those. We used to do the podcast just like if we were doing a regular episode. It was me and Aaron, and we were recording in his basement. And I remember I used to go over after work. It was 8 o'clock at night. I wouldn't leave until like midnight because we would just be trying like different reps and different things and different videos. It took a lot of repetitions and a lot of time to build what we have now. So it's been a journey, which I'm sure you feel the same way with your ACL program. I'm sure it's adapted and changed, and it's going to continue to change. And you'll introduce new things and change things, and it keeps happening.
Yeah.
So that would be our next question. Do you have anything up
I-
and coming? Anything planned? I stole it from Tommy again.
Yeah, I mean, I'm constantly trying to grow my client base. So that's something that is kind of always a work in process. I tell this to my clients, even the ones that are working with me, like, how do I improve? Like, what could, like, are there things that I could do better? Because ultimately, my business is built for them. And if there's something that I can help them with, then ultimately, like, I want to know so that that next person that comes in, like, I can help them. Um, and I mean, there's no bad feedback. It's whatever they feel, comfortable sharing with me. Um, So that's one. The other thing that I'm starting to do is I actually started my own Discord server. So I have it's called the ACL Comeback Club. It's a Discord server. It's on my IG. So, anyone that wants to join that, who's going through ACL rehab, it's really what I'm trying to do is build a community of like-minded individuals, people that are recovering from this injury, and provide support. So there's free resources, and it's just structured really, really nice for people to kind of share different parts of their journey. So, I have a channel called Struggles. I have a channel called Wins and Milestones. There's a Ask Ryan channel. There's ones that you could basically write down like their reflecting on their process. So I call it like my recovery journal. And that's to me like something that I'm kind of trying to do. So if there's any ACLers out there that are interested in the community or, want support in other ways, like it's a free resource for those people going through the tough time.
I love that. Ryan, if you don't mind, when we're done and we wrap up here, send me the link to that and I'll post it in the description of the video for the podcast on YouTube. And when we post it to our stories and stuff too, we'll add the link to our YouTube video and to that Discord server. So this way we can definitely spread some of the news and the resources for that. I think that's awesome.
Yeah. I think one of the things, especially with that recovery journal, like one of the things that I think is very helpful for people, and this is just like a side quest, but when people are going through this injury and they are kind of lost, like the best thing you can do is really reflect on where you are, and writing down kind of what you're going through, what you're grateful for, what's improving, what still needs to work on. That's something that I tend to share with a lot of the clients that I work with. And if they do that like kind of consistently, whether that's like, doesn't have to be daily, but weekly or monthly, like you can then not only reflect in that present moment, but you can also reflect looking back at all the past journaling that you did. And so then it doesn't seem like you're in this terrible stage forever because it'll get better. You just got to keep going. So I kind of share that as a way of not only motivation, but support through the process.
Yeah, like sometimes I'll say to my patients, like sometimes it's hard for you to tell you're improving because you live with yourself and you're with yourself every day. Whereas we see you maybe once or twice a week, or Ryan, like you, like once every 5 weeks, and you're like, oh wow, that is a big improvement. Like I could really see it, and it just gives them like a little extra guidance. And I do really like the Discord too, just having a community. Like not only they have you to guide, hopefully when they're done with you or done with therapy or coaching, they have a community that they can talk to, or even while going through it, and you can sort of bounce ideas off of each other. Like you said, that you have the struggles page, like that I'm sure that's something that can be very valuable for anybody that needs that type of stuff.
Yeah. And I just like how organized Discord is. So you can like really organize, like kind of, there's certain other social media and different other, websites that are really, really challenging to kind of like keep tabs on, I guess, if that makes sense. And Discord does a really good job of kind of keeping things kind of in certain sections.
Yeah, I think that Discord has like a little bit of a learning curve to get used to it, but then once you get into it, it's very handy, very nice, easy to communicate with a bunch of people all at once. So yeah, we're big Discord people.
Yeah, we like Discord, but now Ryan, I really like that you brought up that journaling side of it too, because it really is such a powerful tool that you can just have documentation right there of yourself and things that you were doing in the past. Now you can go back and compare yourself. I love it. I did it. I'm not like afraid to admit, like I went through my own just like therapy and I was told to like journal through it. And as I did it and was able to go and reflect back, you get to see how much you've grown over the time. And it really is just, it's amazing. So I'm very much for it. And honestly, sitting here talking about it, I've got a couple patients just in my head who I know are are struggling and we're at the beginning of the therapy, and I might mention it to them now just to start it and see how they do with it too.
Yeah, no, I think it's super powerful for people, and it's not necessarily it won't necessarily make you feel better per se, but it kind of gets that stress relief of like, this is what I'm dealing with out on paper, and you can at
Yeah.
least acknowledge it. I think some people don't acknowledge their feelings or what they're going through, so it's a way to really, get rid of it, and then also it's a way to kind of track your progress, because I think, like you said, Aaron, people are with themselves 24/7. They don't see, the first week when they're not sleeping after ACL surgery, they don't see the pain and struggle that they're dealing with, because once a month goes by, that's no longer really there. So then they forget that they were there at one point.
Yeah, the best example of that is actually I have a patient that got both hips replaced at separate times. So probably I would say 4 or 5 months in between each one. And she got the first one done. And the first week she was like, "This is terrible. I have so much pain. I hate it." Then she was fine. Good the rest of the time, got a lot stronger, progressed super fast. Then the next round, or the next hip replacement came around, and she was like, "Yeah, that was great the whole time. There was no pain." I was like, "There's going to be some pain. It's okay. But there's going to be some pain." And then she got the surgery, and I was like, "What happened? I have so much pain again."
I don't remember this the first time. It's always if you get the double replacement, that's always the quote with the second one. Like, the first one didn't hurt this much. It's like, no, it did. You just blacked it out.
I think it's usually worse with the total knee replacements.
Oh yeah.
Oh.
Yeah.
Like, they get the one done and then they forget that it was so bad, and then they get the second one and they're like, "Oh my God, this is what this was like. I remember now. I can't walk."
Yep.
Or they start to compare it. Or like, well, but the second one is still hurting. It shouldn't be hurting like this. The first one feels good. It's like, well, let's remember the first one happened 8 weeks before the second one, so let's give it some time.
Yeah, my favorite total knee replacement story was actually when I was still a student. I worked in a hospital, and I had this guy who had a double total knee replacement, and our job was to stand up. That was it. We just wanted to get him standing. Eventually, we were going to get to walking, but standing was step one. So he stood up, got super dizzy, super lightheaded, all pale, and I was like, "Okay, you should probably sit down." He sat down. It was okay. I was like, "Okay, we checked his blood pressure, super low. Don't remember what it was, but super low." And I was like, "Okay, we need to take a good 5-minute break. Let's let it get back. We'll do some ankle pump stuff like that." And he's like, "Nope, I'm going for it." And he stood up and passed out right on the spot.
Love the courage, though. The courage is good.
Yeah. To be honest with you, don't remember why I started this story. But
good.
Yeah,
the crazy things you see, I guess, in the hospital sometimes.
Now, Ryan, I know you're right now. The main focus is ACL. Is there ever a goal in the future to expand outside of ACL, or purely just continue to focus on ACL and expand within that?
I think right now I'm focused mainly on ACL. I do obviously have a passion for soccer players just because I was one, but I work with all different types of athletes: basketball, football, lacrosse, volleyball, bodybuilders. It doesn't necessarily have to be a specific sport. It's ultimately just making sure that I understand the requirements and demands of where they are and where they want to go. Because some people just want to get back to rec soccer, and then there's other people that want to get back to USL, top professional or semi-pro sports. So it's just kind of meeting you where you're at and really helping you. But right now, I think the main plan is just to kind of grow, into the ACL and provide more resources, really focus on trying to grow this, ACL comeback club community, and provide kind of a support community and outlet for not only my clients, but also anyone going through this terrible injury.
Yeah, and even just getting that link out there. it just gives more people opportunity, and it gets your name out there even more too. Friends of friends of friends of friends and all that stuff definitely tends to help.
Oh, yeah.
Sort of circling back to like how to build a brand, things like that. Do you find that there were any big mistakes that you made when you first started that you would circumvent if you had to do it again?
Yeah, I mean, one of the mistakes was like trying to be too specific. So I tried to only work with soccer ACLers. So not only am I taking like a genre or like a a sport, I'm also taking an injury, and that's being kind of too specific from my perspective. Um, so it's either niching down to the injury or it's niching down to the sport. But when you niche down to the sport, there's going to be multiple injuries. So like you can do either. I chose to do ACL just because I really enjoy it, and I also like love the data aspect of it, and I really just I feel like it's the hardest injury to treat to some degree from a knee rehab standpoint. I'm probably a little bit biased for sure, but understanding that, like if I can treat that, then I can treat kind of the easy stuff, if that makes sense. But I would say cartilage injuries are probably up there on, difficulty. I just don't see as many like oats or CartiHeal or any sort of cartilage lesions.
Are there any things that you got from just ACL rehab in general that other people can carry over to different parts of rehab?
I would say, I know I've probably said this multiple times on this podcast, but the data aspect to me is like really, really important because I don't think physical therapists they don't use data enough. There's, now there's force plates, there's like valve equipment, there's Hawkins Dynamics force plates, there's tons. There's Tyndec, which is an inline dynamometer, which helps test strength. So I really try to use, if you're going in person, figure out ways to test people's strength and get numbers. I took the Dungeons and Dynamometers course. I don't know if you've heard of that one. It's a force course with Jason Turry and Chris Juno. So that's a really good course that I took. Basically talks about how to do dynamometry and do it well, because you can do it, but if you're not doing it well, you're kind of wasting your time. So doing it on shoulders. So really, I think using data, figure out ways to measure things and making sure that you're constantly, you have those feedback loops where you're reassessing, program, giving them exercises, reassessing, are they getting better? Are they getting better? Are they getting stronger? Because if they're not getting stronger, you got to figure out, is it the program? Is it them? Is it their sleep? Is it stress? There's a combination of things you got to figure out. And if you're not doing that, then you're not necessarily guiding someone through the process or helping them.
Do you find that like when you're doing remote that it's hard, like sometimes can be tough for people to find like the tools that they need to, I guess, accurately assess the strength?
That objective testing.
I test like I'll do like a knee extension 3-rep max or a hamstring 3-rep max. It's not amazing by any means, but it's something. And then the other times like towards the end of their rehab, I'll get them IsoConnect tested. I'll find a provider that can do it for them, and like basically connect them with a provider locally. I've done that, or they go into a clinic that gets isometric tested. So there's multiple ways you can go about it. Sometimes you just kind of pick what they want and also what's going to be in their best interest.
Makes sense.
When you say that you're doing the 3-rep max, is that something that they're like administering at home as they're doing it, or
in the gym?
In the gym, gotcha. Oh, so you're like, I see what you mean. You're doing it on like a weighted machine and seeing how many did. Gotcha. Okay.
And then I think the other thing that we can go down this rabbit hole if you want, but so many people you see it in the sports space. They use like limb symmetry index, and they're constantly like comparing the good leg from the bad leg, good leg from the bad leg, and like it doesn't really tell you anything. Especially if their bad leg or their good leg is weak. And so, you know, when you see someone that is 200 pounds and they have maybe a 90% limb symmetry index, but they can only, you know, push out 100 pounds, there's an issue with that. Because ultimately they weigh twice as much as how much they can kick. And so it's really reverse engineering and making sure that they can handle what they need to handle. So I like to use their body weight and really try to figure out like what numbers do they need to hit based on the person they are, the sport they are, the sport they play. So that's kind of one of my pet peeves. I mean, limb symmetry is great. It's just you have to make sure that you don't go down that rabbit hole of like how many times they have just 2 weak legs and it's like 90%. And you're like, well, and you know, 90% is the cutoff to return to sport, but they're not even close if they're not kicking enough or they're not strong enough.
And I guess
like they don't have the actual pure strength in their legs or extremity, whatever they're working on, to take that load too. Yeah, that's very important. Sorry, Aaron, you were gonna say something?
Well, I was going to say, like, that's why we're so important too. It's that we're able to digest information and not just take it with a grain of salt. And that's also why, like you said before, Ryan, that the communication you have with each person is so important. Because if you just look at a test, sometimes it might not tell the whole story.
Yeah, no, exactly. And so I think using data is really important. It's one of my pet peeves. I actually, before this call, looked at the study. It was on JOSPT. Basically said that 56% of respondents use manual muscle test as their only method of strength testing, and that was in 2018. And then 80% indicated that they use it to make decisions about initiating jogging and modified sport activity following ACLR.
It's actually crazy. Now that you mentioned that.
And so we wonder,
it's kind of
wonder like, why, you know, ACLers are, again, it's multifactorial. I'm not trying to say like that is the only reason why people are re-tearing and whatnot, but
it's a big one.
When 100 and 200,000 people in the US tear their ACLs every year, and then a lot of them re-injure, like 25 to 30% re-injure, you know, there's statistics to show we're just doing a poor job of like rehabbing them. And it's the rehab really that it's not the surgery a lot of times, it's the rehab that is failing them.
Yeah, like they're skipping steps or they're missing some of the most important things so they get back to where they need to be. The MMT thing is interesting to me too. I mean, it really is sort of not a good test. I mean, I have used MMTs, but they're really almost like I put them on for insurance, honestly, more so than use them that often. Like for me, if a guy has a 5 out of 5 MMT and they can't stand up from a chair, that's probably not a good thing. Like it's sort of useless.
I'm going to say something, and I hope I make sense with how I'm saying this. I feel like MMT is the most subjective of the objective tests when it comes to strength, because it's also dependent on the therapist and the force that they're delivering back and us determining, like, okay, that's where this is at. I feel like it's overall not a great way to test strength, and a functional test is a lot better way of a test to test the strength, and you're also getting coordination and everything else with it too. MMT I was never a fan of, but unfortunately, like Aaron said, insurance.
Yeah. And then you think about like handheld dynamometry, which isn't really also, it's a good way to get objective numbers, but it depends on how you do it. So because there are going to be a lot of flaws with it. If you're like holding the dynamometer and having them kick into your hand, you're going to be putting as much force into it as they're kicking into it. So you're just not going to get a good number. It's like figuring out ways to have a fixed surface so that when they kick into it, that's not going to move, making sure that, you know, it's a 90-degree angle, because if we know trigonometry, 90 degrees is 1, sine, cosine. and then you can do math. So it's like all those sorts of aspects that I think are important. I take it like kind of like a research experiment to some degree.
Yeah,
And it's sad because nowadays I feel like we get robbed of that in the clinic at times because of, let's throw back to what we talked about at the beginning of the video, which is the timing. Like, I've only got a 45-minute block with this patient, and after that they're gone because of the way we have to schedule and our timing. And sometimes it's like picking and choosing, unfortunately. Like, all right, we can do that, or we have to get into the strengthening, or we have to get into our exercises, our rehab. So sometimes it gets thrown to the wayside in many situations.
Yeah, and we really could probably talk for hours about what you could, or the entire U.S. could do to help prevent it or make it better. But it's definitely very evident that like people need time. You can't just spend 5 minutes with a person. And we hear it from every healthcare professional. Honestly, you hear from physicians, OTs, PTs. It happens all the time that people just don't get the time that they need. I have had a bunch of time where I would send a person to a physician, and to me, it would be blatantly obvious, like these things line up saying that this thing is going on. And then they'll come home and be like, "Hey, they said I was fine. They took my heart rate." I'm like, well, here we are.
Did they move the knee? Like, no, they just had me stand up and sit back down. But they didn't even touch you. So those are the ones that blow my mind.
Yeah.
Well, and then it's also using time as a measurement, which is like we all know that that's not ever going to tell you whether you're ready to play or not. Just because your tissues are healed, a lot of doctors use protocols based on tissue healing that maybe the graft is healed, but doesn't necessarily mean you're prepared. And so that's where it's like the number of questions I've gotten from people where it's like, I'm 9 months status post ACLR quad graft, like, and I have knee pain, like, what should I do, or what exercises can I do? It's like I have no idea, because you could be 9 months and you didn't do anything for 9 months, or you could have maybe gone to PT twice a week, or you could have been not consistent, or there's such a continuum of where you could be that the 9 months mark doesn't really give me a clear picture about where they are.
Shout out to the Moon protocol. Everyone remembers that one from grad school, I'm sure. As soon as you said, I was just like, Moon. Oh, the gray areas. PTSD, gray. Gray areas.
Yep.
50 Shades of Gray areas.
Now, believe it or not, we're already coming up on an hour. Ryan, do you have anything you want to shout out before we wrap up today?
I would just say, if there's anyone out there that is listening, if they're going through ACL rehab, going through their own ACL injury, need help, have questions, want other resources, want to join my community, they can feel free to DM me on Instagram. I'm sure you can click on the link as well. That's going to be provided on the Discord community. Just want to be like a transparent source of good information for people, and really help them, not only recover fully, but have, confidence and clarity, getting back to, whatever sport or activities they want to get back to. But yeah.
Nice.
I love it. In the description of the video, we'll throw in Ryan's Instagram handle. We'll throw in the link for the Discord. We'll also share it on our Instagram. We'll throw it up on our stories. But yeah, thank you, Ryan, for coming on.
Yeah,
thanks for having me.
Yeah. All right. Have a nice night, everybody.